everybody. Welcome to DE Business Lab. I'm Dr. Pam Maragliano Muniz, Chief Editor of Dental Economics. Now, DE Business Lab is a video series where we kind of talk about maybe some changes in the industry or some services or some topics that might make our practices better. And today is just that. So with me today is Kendra Sellers. She's a dental hygienist and has been in the dental industry for over 30 years. During that time, she has continued to see dental offices struggle with implementing medical billing as a solution and created Tips Medical Billing, where she now coaches top performing practices on having massive success in helping their patients and their bottom line by successfully billing medical insurance carriers. So this is a topic I don't know that much about, and I think that this is really interesting. So Kendra, thank you so much for joining me today.
Absolutely. Thank you so much for the opportunity. I'm excited to share with you what all the knowledge that I've gained over the last several years about medical billing.
That's amazing. I know that sometimes we think about medical billing and we think we can't do it. So what types of practices can bill medical insurance? Is it something that all private practices can do, or is it something where you have to be part of a clinic or a hospital-based clinic, that kind of thing? Who can bill?
Actually, any dentist can bill. There are statutes in place that actually allow dentists to bill and not be discriminated against their provider type. So we can absolutely bill to medical as a dental provider. You do not have to be affiliated with a hospital or anything like that. I wish there were more dentists affiliated with hospitals because there is such a need. There's so many emergencies that come through the hospital setting that are not, they get referred back to a dental office, and the patient didn't go there in the first place because they don't maybe have dental benefits. But absolutely, any dental provider can bill to medical.
What types of procedures can be billed?
Actually, a lot of procedures that you wouldn't think about. Your exams, if you're doing a head and neck evaluation, you're not just counting teeth, all of those exams can actually go to medical. You can bill your PANs, your CTs. I get often asked about CTs. We can absolutely bill CTs to medical. You can bill TMJ services. You can bill sleep appliance services. And when I talk about those things, that also includes the evaluation for that and some of the diagnostics that go along with it, not just the appliance. You can bill your surgical services. So bone graft, cyst removal, implants, alveoloplasty, what we call sinus lifts. Those are grafts in medicine. So all of those things can be billed to medical.
So we can kind of bill anything really to dental or medical insurance, I guess. But I guess the bigger question is, will they actually reimburse for these procedures? And what's their reimbursement service, like their reimbursement like?
So reimbursement is quite different on the medical side versus dental. The reimbursement is always much higher. There are a few procedures like the Panorex that can be bill that they don't pay well on, but I see those often written off. So it's better than being reimbursed zero for that procedure. But reimbursement is much, much higher than anything in a dental fee schedule. So when we look at fee schedules, whether you're in or out of network, because I think that's important as well. That's a whole nother topic, but you don't have to be in network with the insurance carriers to be able to bill to medical and bill those procedures. So it's a very different ball game. Is what I can tell you. It's very much more reimbursable. I quite honestly, with the overhead in dental practices, I'm not sure, now that I know what I know about medical, I just don't understand how practices can stay alive and stay profitable with the dental reimbursements that we see. I mean, they haven't changed since the 1960s. We also lose that maximum that we have in dental. We don't have that in medical. So, $1,500, $1,000 max on a dental benefit isn't going to buy the patient much anymore. Where we can bill some of those things to medical and save their dental benefits for dental tooth related procedures.
So if, say, a or medical reimbursement will reimburse part of a procedure, can you also submit reimbursement for the same procedure to dental to try to get your entire fee?
Yes, you can. You can bill to both medical and dental. They are completely separate policies that the patient pays for, and they're billed differently. It's just a matter of being able to understand the cross-coding part of it, to be able to identify what code is best to be utilized for that procedure. Where I struggle with that is often dental offices are not always correctly identifying the dental procedure that they need to bill. So to try to cross code it doesn't always work well. So it's just education on that.
I was going to mention the coding because I don't know a lot about medical billing, but I do know that you can't use a CDT code to submit for medical billing. Where
Correct.
can practices try to figure out what codes we can use to submit for medical billing?
That's a learning curve, and that's what I help practices with. What I saw is a lot of practices wanting to do medical billing, but not understanding it. It's not something that we learn in school. We definitely have a different code set. They're called CPT codes versus CDT codes. We also have to provide a diagnosis code along with that CPT code in order to be paid by medical. These are things that were not taught in school. I wasn't taught in hygiene school. You weren't taught in dental school. It's not part of the curriculum, which is surprising to me with where we're at with the whole oral systemic health and all that can be billed to medical. Patients have benefits for these things, and we need to learn how to bring that forward for them. So that's what I do. I saw that gap between medical and dental. I see a lot of practices going to seminars, 2-day courses, but then how do you bring that information back to your team and implement it? That's where the failure has been. So that's my company. That's my niche is I come in, I work with the team one-on-one, and we start this process, and we start it the day that I'm in the office, and we start doing retro billing because a lot of insurance carriers, we can bill up to a year retro. So we start that process and we start seeing reimbursements right away.
Wow, well, that was really going to be my next question. I know we have just a short time together today, but I know that a lot of people might be thinking, wow, I would like to figure out if this is the right fit for me and my practice. Where can they get more information?
Sure, reaching out to me, just let's have a discovery call and learn about what it is you're wanting from medical billing and how I can support you. You can reach out to me at my website, which is tipsmedicalbilling.com. And there's a contact page. Just reach out to me via that. Tell me a little bit about your practice and how we can schedule a call. You can also feel free to text me if that's easier. My number is 612-418-7870.
Awesome. Well, thank you so much for your time and for bringing up this topic and making it something that will hopefully help us get better reimbursements for our practices and ultimately helping our patients get the care that they need at a more affordable rate. So, Kendra,
Absolutely.
thanks so much.
You're welcome. Thank you so much for this opportunity.
Thank you. All right, everybody. And I will see you next time for DE Business Lab. I'm Dr. Pam Maragliano Muniz.